Today, I will be demonstrating a new procedure that I've developed that uses a special stitch at the back of the throat to tighten the soft palate and help reduce snoring. It's a brand new procedure that is my development, and I'm getting excellent results with it. It's done in the office with the patient awake. It takes about 20 minutes to do, and there's no downtime. There is some pain associated for the first few days afterwards, but it's what most people would just call a sore throat for a couple of days. And the sore throat then returns to normal, and the benefits to the snoring become more and more evident over the first few months after the procedure and are expected to be long-lasting or permanent.